Namaste. Let us understand staphyloma. In staphyloma, the outer tunic of the eyeball becomes thinned out and it bulges out, and the uveal tissue shines through the surface. Let's understand the definition. Staphyloma is localized bulging of thin and weak outer tunic of the eyeball, that is cornea or the sclera, lined by the uveal tissue which shines through the thinned out fibrous coat. How does this occur? Normally, the sclera maintains the shape of the eyeball. But when the sclera becomes thin or weak and there is pressure inside the eye, the sclera bulges outwards. Let's see the types. The anterior staphyloma has bulging of cornea and nearby sclera. Next, we have the intercalary staphyloma. It includes the root of iris and anterior ciliary body. The third is ciliary staphyloma. It is easy to get confused between intercalary and ciliary staphyloma, but the ciliary staphyloma includes the ciliary body. Next is the equatorial. The equatorial staphyloma is due to the bulge of sclera which is lined by the choroid in the equatorial region. It occurs most commonly in areas which are perforated by the vortex veins. Behind the equatorial staphyloma, we can see the posterior staphyloma. Posterior staphyloma is a bulge of weak sclera which is lined by choroid behind the equator. The most common cause of posterior staphyloma is pathological myopia. So the types are anterior, intercalary, equatorial, posterior, and ciliary. Before understanding the causes, you have to again remember the pathophysiology. First is, it was due to increased pressure in the eye. From there you get the cause glaucoma. And next was thinning of the outer tunic of the eyeball. So the causes of thinning can be high myopia, trauma, complications of corneal ulcer, the cornea will become thinned out, inflammation such as scleritis, and congenital weakness. The patient can present with blurred vision and progressive reduction in vision. He can present with a visible bulge, which can give him a cosmetic deformity. And if inflammation is present, such as in scleritis, he will present with pain. The diagnosis is mainly clinical, but we can make use of ophthalmoscopy to visualize the fundus, slit lamp examination, ultrasound B scan, and OCT. The treatment depends on the severity and the cause. We treat the cause first. If the cause is glaucoma, we control the glaucoma and give anti-glaucoma drugs. If the cause is inflammation or infection, we treat the infection. If the cause is myopia, we provide corrective lenses. And if it is severe, we can do surgical repair. Thank you. That's all about staphyloma, and please subscribe for more such videos.